Hey guys, it's Jessie with Omaha Mom Talks, and I have some exciting news. I am partnering with Edwards Auto Group, a local car dealership with locations in Nebraska and Iowa, for a fun partnership called Mom versus Machine. Every couple of weeks, I'm going to be test driving a new family vehicle and giving it the full mom review. We're taking it out of the showroom and into the hands of me and my family of four. We're going to be seeing if it can handle car seats, snacks, strollers, backpacks, how easy it is to clean, how much room do we have, and I'll be giving you my honest thoughts. If you have a car that you have been eyeing, let me know. If you have any must-have amenities when looking for a car, share them with me and I'll be sure to give those a closer look. Follow along and see which car can actually keep up with our family chaos. All right, welcome back to Omaha Mom Talks. I'm your host, Jessie Gutierrez, wife, mom of two, and maternal mental health therapist. Today, we are jumping into a chat that I think almost every mom has experienced, at least all of the moms I personally know and support, but not always all moms feel safe admitting this, and that is the topic of mom rage. Today, we are going to be talking about this conversation, normalizing it, explaining what contributes to it, and also hopefully leave you with some tips and strategies on how to manage that mom rage. If you have ever slammed a door harder than you would like, snapped at your kids, felt anger rise so fast that maybe it scared you, this chat is for you. We are going to be joined with Nicole McNelis to guide us through this conversation. Nicole is the founder of a private practice in Philadelphia. She is an expert on mom rage. She is a conference presenter for Postpartum Support International. She supports clients navigating overwhelm and major life transitions, and I'm so excited for you guys to learn from her today. Let's get into it. All right, Nicole, welcome to Omaha Mom Talks.
Thanks so much for having me. I'm so excited to be here to talk about mom rage.
Yes. So before we jump into our chat about mom rage, I would just love to get to know you a little bit. So the human behind the professional title. So tell our listeners just a little bit about you, family life, anything you want to share with us.
Yeah, absolutely. So I am a maternal mental health therapist. I have a private practice in the Philadelphia area. I am a mom to two. My kids are now 13 and 9, so we are officially in the teenager stage of life, and it's going okay so far.
Okay.
We're doing okay. I also, in addition to the clinical work that I do with my clients, I also do advocacy work.
Yeah.
I do a lot of speaking and training. So I train other therapists specifically on the topic of mom rage. I also do some research, which is really exciting. So I'm currently involved in an active research project all about mom rage and the clinician experience of mom rage. And
Okay.
then I just took on a new role as a college professor at Villanova University here in the greater
Awesome.
Philadelphia area, where I'm teaching a counseling for women class, which has
Oh,
been
wonderful.
really just an amazing experience. It's pretty cool to get to work with the next generation of therapists and counselors, and I'm just loving it. So
Yeah.
yeah, I get to wear, I'm really fortunate. I love this work that I do, and I get to wear all of these different hats and
Yeah.
be creative in lots of different ways. So it's just been, yeah, it's really wonderful.
I love that. So you're offering support on so many different levels, which is really unique, I feel like. Sometimes we just fall into one level, right? So that's really cool. So tell us a little bit about, if you feel comfortable, about your like early motherhood experience. And I'm always curious to know if that shaped or led you into working in maternal mental health.
Oh, absolutely. There's a direct line from my early motherhood experience to my work in maternal mental health. I think, like many of us in this field, I really feel like maternal mental health and mom rage found me. They came for me.
Yeah.
And so when I think about my early motherhood experience, especially with my first, it was tornadic. That's the best way that I can describe it. It was all consuming and
Yeah.
really challenging. And I was so fortunate to find some just really wonderful, compassionate support. I found a postpartum adjustment support group that was run by a nurse and a social worker who both were affiliated with the hospital where I gave birth. And they ran that group for 13 years. 13, can you imagine?
Wow.
I
That's
know, they're so amazing. I'm still in touch with them today. They're just so dear. So they ran this postpartum support group for 13 years. They ran it once a month, and it was truly a lifeline for me in my first year postpartum after having my first. And I learned from them the type of support that I needed, first of all, that I
awesome.
honestly didn't even know what I needed. I was so
Yeah.
overwhelmed.
Yeah.
And also, I learned about the type of support that I wanted to provide other moms because I
Hmm.
had, unfortunately, before I found that group, I had some, I would say, missteps and not great fits with some healthcare providers. And I learned very quickly about support that is not compassionate and that doesn't feel caring and that doesn't feel like it's, creating space for whatever the mom might need. And to have that totally different experience with the support group where I felt held and cared for and supported was a complete 180. So I really truly learned about support that was not helpful and
Hmm.
support that was helpful. And that made all the difference. And I really learned about and thought to myself, this is the kind of support that I had in that group was the kind of support that I wanted to provide for moms
Yes.
because I
Yes.
recognized just how critical it was.
Yeah, absolutely. Seeing the lack of support versus the contrast of highly specialized support that feels supportive, right? Really was a drive there for you. That makes a lot of sense. So we are going to just jump right into this chat about mom rage because I know like it is something that I've experienced, the majority of my friends have experienced, and certainly the moms that I support in my clinical work have experienced as well. So I hope in our chat today we can normalize it, bring some light into what is really happening there, and then as well as some takeaways on things that moms can do, whether it be daily wellness practices or like in the moment tips and strategies. So before we jump into that, let's just define it. How do you define what is mom rage?
So, the way that I like to define mom rage is I found that when I reflect back to mothers in the therapy room, that it feels like they are drowning and exploding at the same time.
Yeah.
That is something that really resonates. It is this
Uh-huh.
all-encompassing, overwhelming feeling of this white hot rage, and it is very very specifically tied to the experience of motherhood. So that is how I define it and how I describe it to mothers.
Wow.
When we look at the academic research on mom rage, it's frequently described as episodes of intense anger directly related to motherhood that are frequently derived from feelings of powerlessness, injustice, and stress, which I think is really important to recognize. This rage is not random, didn't just come out of nowhere. It's connected to the experience of motherhood, and
Hmm.
usually right underneath it and directly connected to it are these feelings of powerlessness, injustice, and stress.
Yeah. Yeah. Well, and I think when we frame it in that way, it really does. I guess one of the messages that I always want mom to know is that this is not something that's wrong with you. You are not a flawed human being. This isn't a hierarchy of how good of a mom you are, that this is a very normal and understandable emotional experience that some of us, experience maybe more frequently, more intensely, but that we all experience at some degree, at some level.
Yeah, yeah, that's exactly right. Mom rage is not a character flaw, right? It's a signal. It is an emotional experience that is telling us something. And then as therapists, I really look to help clients help them figure out, okay, what is this message then, right? What
Hmm.
is the rage trying to tell me, right? Because
Hmm.
this emotion is information, and that information is critically important to figuring out what the next steps are. And
Mm-hmm.
so when we work with mom rage in a compassionate way, when we don't fight it, I don't ever encourage my clients to fight mom rage. Fighting mom rage is a losing battle, right?
Yeah.
This is an emotion that is coming up for a reason, and it is trying to tell you something. Don't fight it. There is nothing wrong with you. You are not broken. What we want to do is we want to work with it and figure out what it's trying to tell you so that then we can get you the support that you need.
Mm-hmm. So I'm just thinking in my head about, so we're hearing a lot more about mom rage, right? Like certainly with social media. And what would you say to mothers of like the 80s and 90s who are like, we didn't talk about that, or that just wasn't a thing back then? What would you say to those mothers?
First of all, I'm so thankful that we are talking about mom rage
Yeah.
differently, that we are recognizing that this is a phenomenon that moms are experiencing, and that there must be something going on here. There's
Hmm.
something that we need to pay attention to. And so, the moms in the 80s and 90s, they experienced mom rage, but we just blamed it on them. We looked at it as an individual problem. We looked at it as that mom is hysterical, that
Yeah.
mom is crazy, that
Yeah.
mom is out of control, rather than that is a mother who is struggling. That
Yeah.
is a mother who is unsupported. That is a mother who is overwhelmed and overstimulated, and she needs support. The
Yeah.
thing that I always remind my clients about mom rage is, as difficult as it is actually an opportunity and can be a catalyst for positive change, right?
Hmm.
The mom rage is telling us that something in our system needs to change. That's what it's telling us, right? It truly is not an individual flaw. It's not an individual problem. We truly have to widen the lens and look at what is going on around this mom to understand that rage, and again, to understand what it's trying to tell us. So mom rage has been around probably forever.
Yeah. Yeah.
And because rage is an emotion that's been around forever, right?
Right.
And we just
Anger is a primal feeling.
that's exactly right.
Yeah.
And it's protective in many ways, right? Mom rage is exactly the same, right? And so I'm so glad that we are understanding it differently, that we are talking about mom rage differently. And honestly, it breaks my heart when I think about
Yeah.
how, we used to talk about mom rage, and how, we still don't treat mothers, I don't think, particularly well. I think they still need a lot more
A lot of
support.
compassion.
And
Yeah.
right. And but it was worse. So it's all relative, right? And
Yeah.
so I'm glad that we're talking about it differently. We're talking about it in a more open and compassionate and understanding way, honestly.
Yes, agreed. So I love what you said a little bit ago about mom rage is a warning sign, right? That there's something happening. Um, a lot of times, feeling overwhelmed or unsupported. But let's chat a little bit about like what is happening beneath the surface when rage is showing up.
Yeah, so mom rage typically happens in a cycle or a pattern, and there's three steps to the cycle. So the first step is the buildup, right? And that's what you're referring to. So the buildup is all of those things that gets us to the point of feeling like we're on the very edge of what we could possibly
Can we
manage,
name
right?
some of those? Because
Oh,
I
we
can't think of
can. Okay.
a dozen.
Yes. I feel like you want to throw some out there. I feel like you
So yeah,
have
well, I
some.
mean, I'm thinking I have a sensory capacity,
Mhm.
right? So like if the TV's on, someone's playing a loud game and someone's whining in my ear, those are going to meet my threshold for sensory input. And so that's part of my buildup for sure.
Yep.
What are some
Yeah.
other ones that you think
Yeah.
of?
So that's exactly right. So the buildup, right? The buildup stage of mom rage is anything that, again, pushes us to this very edge of what we can possibly handle. So that could be sensory overload, like you were describing. It could be emotional overload,
Mhm,
feeling like I am taking care of everyone to the best of my ability, and it's not recognized or appreciated, right? That emotional labor that gets taken for granted, right?
mhm,
It could be the physical labor of motherhood, right? The person at the end of the day who's cleaning up all the things, who's putting things in order, who's getting everybody ready for the next day, right? That's a very physical labor. That's a very physical part of motherhood. It could be all of those things combined, right? It could be pressured situations where you're trying to get everyone out the door in the morning, where the mom is trying to get to her job, right? The paid work that she does. She's also doing all of this unpaid labor around the
Yeah.
house. And then you have a toddler who's throwing their shoes around instead of putting them on, and a baby who's crying in the background because the toddler is acting out. And now the baby's overstimulated, and the only way that they know how to react is crying, right? Like,
Yeah.
I can, as I'm describing these situations to you, I can actually feel the
Same.
overwhelm,
Same.
right?
Same.
Do you
Same.
feel it in your body?
Yeah.
I feel
Yeah.
the
I feel
overwhelm.
it. It comes in my chest and it comes
Yes,
up like it wants to erupt, right?
yes.
Like very lived experience for
That's
sure.
exactly right. So mom rage is also that, those feelings of being on edge, that very edge of the buildup is also really somatic. So yes, all of these things add up to this feeling of the buildup stage, right? So that's stage one. And then stage two is the explosion. So that's where the mom rage comes out in some fashion. It makes its way known. Frequently, it's external. So that
Mhm.
is a mom yelling at her kids, slamming some doors, hiding in a bathroom, any way that the rage kind of makes its way out. Here's the interesting thing about mom rage: the expression can also be internal, right? This is where moms are saying terribly negative things to themselves.
Yeah.
I'm such a bad mom. I should not feel this way. All of those different types of
What
negative
kind of
self
mom
talk.
am I? I hear that a lot.
Right. My
Anger
family
management.
deserves
Mhm.
better,
Yeah.
right? All of that. Good moms don't get angry, all of
Mhm.
those types of things, right? So, stage two is the expression of the rage. And again, it can be external, it can be internal. Frequently, it's actually both at the same time, right? The rage is coming out and we're also saying terrible things to ourselves. And then the last stage is the aftermath. And that is typically where we get the guilt and the shame,
Yeah.
where a mom is then saying to herself, I can't believe I talked to my toddler like that. They're just a toddler. Like they were just struggling to put on their shoes. I can't believe that I yelled at them to get us out the door. I feel so terrible. I'm such a bad mom, right?
Mhm.
So that's the pattern that we see when we're looking at mom rage.
Yeah. And I I think that it is important to know it's not just about what happened, like in that moment, right? Looking at it once you're in a different state of mind, right? Because in the moment, it's really hard to be curious. But if you can in the moment, great. And that is a practice over time. But being curious about like that build up part, because that is usually where we can start to identify what are my needs or what are the things that led to like if we don't know the trigger to a behavior, it's really hard to change the behavior.
Yeah, that's exactly right. That build up stage can be weeks long, right? It
Yeah.
can be just a few minutes. It can be a lifetime, right? As moms, and as women, sometimes we can feel like unappreciated for a lifetime, right? Or like no one has ever listened to us or taken us seriously, right? And then
Hmm.
you have that reflected in your motherhood experience. So that buildup can actually be related to years of feeling not listened to and not validated and uncared for, right? And then it explodes in this moment of mothering. So, yeah.
Yeah. Yeah. Well, and that let's talk a little bit about just the invisible labor, the mental load, the emotional load, the logistical load, and how much of mom rage and anger is about just carrying too much and doing it alone or with a lack of support.
Right. So part of that buildup for mom rage is the overwhelm and the overstimulation, right? So if you are the default parent in a household or you are solo parenting, or for whatever reason you are carrying the bulk of the household and parenting labor as the mother, that is exhausting.
Yeah.
Parenting is relentless, nonstop labor. It changes at different points as our children grow and change, but
Yeah.
there is always labor there, right? So the way I frequently explain it to clients is when children are young, the labor is usually really physical, right? You're changing diapers, you're, trying to make something that your toddler will actually eat before they throw it on the floor, right? You're strapping little ones into car seats as they're fussing and moving around, right? It's like
Yeah.
very, very physical. And then as children get older, that labor is still there, but it frequently becomes more emotional, right? Where those children are dealing with relationship challenges and struggles at school and very complex dynamics in their friend groups, right? And so that labor is always there. And if you are the parent who is taking on the bulk of that labor and feeling unsupported, that is exhausting, that
Mm-hmm.
is overwhelming. That can then become a trigger for mom rage.
Mm-hmm. Mm-hmm. And a part of the work that I do, and I'm sure that you do as well with your clients, is helping clients identify what their needs are. Sometimes some of my clients don't know what their needs are. And so that's some work that we're doing. And other times it's, no, I know what I need, but there's some messaging from early childhood experiences or other experiences that have led them to think like my needs aren't important, or my needs take up too much space, or my needs take away from other things that are more important. Tell me a little bit about how you support moms through that work.
Yeah, so that is exactly right. So frequently in motherhood, a lot of the messaging that we get is that we need to completely push our needs to the back burner, right? That everybody else's needs come first, right? And what I encourage my clients to do is your needs at least need to be part of the conversation, right?
Mhm.
Like sometimes if you have a sick child, yes, their needs come first, right? But you have needs also, and those needs get to be part of the conversation. So I have an exercise that I do with clients, and it speaks directly to this idea of unmet needs.
Mhm.
Because when we look at the research, we know that two things that really contribute to mom rage are unmet needs and also violated expectations. So, this idea that we go into parenting, that we go into mothering with these
Uh,
expectations, and frequently those expectations are not met. So, what I ask my clients to do is I ask them to think about the last time that they were actually able to hear themselves think. Because
mm,
so frequently as moms, that ability to hear ourselves think is like stripped away from us, right? We're just trying to get through the day. We're just trying to survive. We're just trying to make sure that everybody is okay. So I asked them to slow down and think about that. Think about the last time they were actually able to hear themselves think. Were they sending their friend a text message and they could actually hear their own thoughts and process for a moment?
yeah.
Was it in a therapy session? Were they in the car by themselves, right?
Yeah.
Listening to the music that they wanted
Oh,
to listen to, right? But there's lots of was it in the shower? Was there an opportunity where they didn't have somebody banging down the door? They actually had a
or in the
moment,
shower
right?
with them, which
Right.
is my life.
Right. Wherever that opportunity arises where you really felt like I can actually hear my own thoughts in this moment,
Mhm.
right? And I
Mhm.
ask clients to think about that. I ask them to think about what they're doing, what they were doing in that moment. And then we look at how can we help you to access that at other times, right? Because I think when we think about coping strategies, particularly with mom rage, we want to make sure that we're not just like adding random things to a
Yes.
mom's already full to-do list, right? Like we were just talking about this. Moms already have enough things to do just to try to get through the day. If we're talking about coping, it needs to be accessible, and the client needs to feel like, or that mom needs to feel like she can just reach out and grab whatever that coping strategy is. And so
Mhm.
I like this exercise because we're looking at where are the moments that you already have these little spaces in your life where you can hear yourself think, and how can we help you access that a little bit more? And then that also tells us what your needs are, right? If the last time you were able to hear yourself think is when you were texting a friend and telling her about your day, maybe connection is the
Mhm.
unmet need. Maybe you need a little bit more connection. Let's think of some really realistic and practical ways we can bring some more connection and community into your life, right? the last time you could hear yourself think is when you were driving in the car by yourself. Maybe you need some more alone time. Maybe we just need to add 5 more minutes of alone time to your day. Let's figure out a way to do that that'll actually work for you. So I love
Yes.
that exercise because it's practical, it's grounding, and it can really give us a lot of important information.
Yes, yes. So I'm going to share like a real world personal example there. So I am married and my husband travels for work. And so I had noticed that on the weeks that I am solo parenting, um I'm just a little bit more frazzled. I'm used to having a very, involved partner and so especially mornings, like that kind of example of like getting off to work, getting everyone dressed, clothed, fed, teeth brushed on time out the door. And so I wasn't acting, the way that I prefer to act or respond with my kids. I'm like more annoyed, more frustrated. I have this just like, let's go, let's go, let's go energy. And I had always told myself I wouldn't be that mom because my mom was like that. And I knew from experiencing it as a child, like it doesn't start your day off great. And so then I found myself in that same pattern. And I didn't like it. And so I got curious about, what is thinking of this as a message, like what is it that I'm needing? What are my unmet needs and what can I really do about that? Because I'm feeling a lack of support, but like my husband has to work to, provide for our family and travel. That's just part of our real life circumstances. And so, again, this is kind of a bit of I do want to just say like I'm self-employed, so it's a privilege that I can stack my schedule and make that work for me. But what I now intentionally do is I make my work demands a little bit lower on the weeks that he is gone. And I try not to take on extra projects or extra things for the PTA or boards that I serve on. I have to say no to things and set those boundaries and be protective of that week, knowing that I'm taking on more parenting stuff that week. And that allows me to have just a little bit more margin of breathing room there. And so that's one thing that I do for myself.
Yeah, that's a great example of really purposefully and meaningfully shifting that labor, right? And shifting that unpaid labor and that paid labor when you have the ability to, so that you have a little bit more room, and so that those feelings of being on edge aren't just crushing you during those
Yeah.
weeks that you were solo parenting. That makes a lot of sense.
Yeah. And again, I recognize that not every mom has that same ability. And I'm just sharing one example of what has worked for me. I also want to just chat about in my experience with the moms that I support, there's often that, well, we already named, but that shame spiral, right? And so they're often telling me, like, I'm scared by that reaction that I had. And especially if moms have had either moms or dads from their own childhood experiences that were big yellers or physically abusive, right? That reaction can be really scary and there's so much shame. And then as we know, shame is tied to our identity, like who I am as a person. So maybe we could chat a little bit about that. And if you could explain to us the difference between guilt and shame and how we can use those. I think of guilt, it can use us to make change, and shame keeps us stuck.
Right,
Um,
right.
how do you look at it?
So, the way I explain guilt and shame and how it shows up specifically with mom rage, it's this idea that I have done something wrong, right? Mothers are not supposed to feel this way. Mothers are not supposed to be angry. Mothers are not supposed to have rageful moments. So, because I have done something wrong, I now feel this guilt and shame, right? And I think what is important to recognize, and I want to you mentioned some really important things, and I want to take a moment to focus on a few of them.
Yeah.
So, in terms of the way mom rage kind of shows up, right? I want to be really clear that the rage that you and I are talking about is the emotional piece of it, right? It's not abusive behavior.
Hmm.
Abusive behavior lies in a completely different category
Hmm.
and needs completely different types of treatments and coping strategies. The rage that you and I are talking about are these moments that are definitely difficult in our struggle, and the rage definitely has ways to express itself, but for the most part, nobody's getting hurt. This is not abuse. So a mom
Mm-hmm.
is getting loud, some doors are being slammed, but this
Mm-hmm.
is not abusive behavior. This doesn't fit
Yes.
into the wider pattern of abuse. So I want to be really clear that that's not what you and I are talking about. And I'm glad you brought that up because that's actually a question that I get asked all of the time is what is the difference between mom rage and abuse? And
Mm-hmm.
abuse is part of a larger pattern where there's actual real harm being done,
Mm-hmm.
physical or otherwise. That is
Mm-hmm.
not what mom rage is. Mom rage
Right.
is it's these episodes, it's these little explosions, and it is mostly the expression of this
Mm-hmm.
emotion, right? This signal that we're trying
Mm-hmm.
to pay attention to.
Yes.
So when we do want to be really careful to differentiate the two, because I think that's part of where the guilt and shame comes from. Also, it can feel like, oh, this is a slippery slope. And so we just
Mm-hmm.
want to be mindful of that. I would say one of the most encouraging things about the work that I do in training therapists on mom rage is I've had so many clinicians come to me after a training and say, this information and framing mom rage in this way as a message and not as a meltdown is helping me to understand my own mother's rage and what she
Mm-hmm.
was going through and
Mm-hmm.
just how much she was doing and how she was being pushed to the edge and she was just doing the best that she can and she didn't have support and we didn't have a name for this and now I have a different way to look at this and now I have a different way to look at my own rage and now I have a different way to help my clients through this, right? I have this new framework to help manage this rage and use it as this catalyst for positive change rather than, like you said, the guilt and shame that just gets people stuck because they feel
Yeah.
badly, they feel like it's a dead end, and they feel like there's nowhere to go from this because I am inherently bad for feeling this way, for engaging in this behavior. And that's where we want to use compassion to gently push back on that guilt and shame and to recognize that this is a message, this is a signal. What is it trying to tell us? And then what do we do with that information? What are some healthy outlets for this rage? What are some ways we can support this mother, right? What are the unmet needs? What are the violated expectations? That's where we want to go with all of that.
Yeah. Yeah. Well, and I did have a mother that was a yeller. She was also physically abusive.
Mm,
And I've done a lot of work, individually for myself around that and my childhood experience. And so I would say first, I personally, for those that are listening that may be able to relate to that, I did a lot of work with my inner child healing before I could ever get to a place of like compassion for my mother. Right. And that was very healing for me to first really soothe and heal that inner child that experienced the harm and the hurt. And it does change certainly once you become a mom too in so many different ways. But also like I remember fearing like that rage lives inside of me. I have that template in my brain and my body because I experienced that as a child. So I was very scared and nervous, right? And so I had to do a lot of work in reminding myself, like I'm not my mother, and good moms can have angry moments.
that's exactly right. And I think what a meaningful and purposeful way to look at that and what a beautiful framework, right, that you've created for yourself and that other mothers can
Hmm.
also use, right? Like
Yeah.
I can have understanding from my mother, but I can also realize that this was painful. And I
Yes.
also recognize that I do not want to perpetuate this cycle. So I'm going to do
Yes.
work to not perpetuate this cycle, but I also recognize that I'm human and that I
Yeah.
can have these mom rage moments and I can work on managing them, that I can hold all of these things as true at the exact same time. That takes a whole lot of really hard work to hold all of those things at the same time, all as true while being kind and compassionate to yourself.
Yes. Yeah. And Lord knows I've done the work and I'm still doing it. It is not like a one and done type of healing
Yes,
here.
yes, so that's another really important point. This is a process, right?
Yes.
And this is a sometimes we don't like to hear this, but it's the truth. This is a lifelong process because these
Mhm.
emotions, even when we've done all of the good work and we feel like we've gotten to a really good place, right? Things still come up.
Yeah.
Difficult situations still pop up, right?
Yeah.
And so our environments change, right? Things happen, right? That can be triggering, right?
Mhm.
And so it is important to recognize that all of that good work is still there, right? And you can still reach for it and you can still rely on it, but this is still going to continue to be a process, right? Because we
Mhm.
grow and change, difficult things come up sometimes. And so we want to be kind to ourselves through that and recognize that this isn't something that we work on and then it just goes away, right? This is a
Right.
lifelong process that the kinder we are to ourselves and the more we work on it, the better it gets.
Mhm.
But there probably is always going to be an undercurrent because rage, like you said, is this primal
Yeah.
protective emotion. And so it's
Yes.
going to come up because it's designed that way. It's supposed to come up, right?
Yes. Yes. So, we are going to jump in to some practical strategies. But before we do that, I feel like I would not be the good social worker that I am if we didn't touch on the fact that there's also a lot of systemic issues that are also contributing to mom rage. And so, while we don't have enough time to go into depth on all of those, maybe you could just name some of the things that you see, certainly in the research and in your clinical work, that are contributing to this in the systems that we live in.
Yeah, I'm so glad you bring that up. And so when I look at mom rage and when I'm training clinicians to work with mom rage and when I'm talking to my clients about their own mom rage, I take what I call a two-pronged approach, right?
Okay.
At the minimum, we want to do what you just did, which is where we at least have to acknowledge the
Yeah.
struggles and the challenges in the system. Even if we don't have a fix for it, even if we feel powerless to some of the
Mhm.
things that are going on in the system, right?
Yeah.
At a minimum, we have to say, we are mothering in a very, very broken system, and you are doing the best that you can. And we have to acknowledge that that system is broken. And
Mhm.
then the second thing that we can do is bring in some individual coping strategies so that we can help with those feelings of powerlessness, right?
Yes.
The
Mhm.
reason that I love individual coping strategies is it can help someone feel empowered, especially when those strategies really speak to their strengths.
Mhm.
So, some of the systemic issues that we specifically face as mothers in this country
Mhm.
is we do not have great access to healthcare. We
Mhm.
don't have particularly good access to childcare. We don't have access to paid leave, right? So these
Right.
are all huge social safety net issues that mothers in the United States do not have access to. And because we do not have access to these different programs, more pressure is then put on us as individuals,
Yes.
right?
Yes.
And then what happens when we don't have these social safety net programs is it then leads to a culture, right, that essentially tells mothers that you are responsible for everything all of the time and you
Mhm.
have to do it perfectly, right?
Mhm.
And you have to be at all of your kids' games and all of your kids' recitals and you have to make them all of their food needs to be homemade and healthy,
Oh my
whatever that
gosh.
definition is at the time, right? And you have to be calm and happy and blissful all of the time, right? Like, so not having these systemic things in place that, so like these systemic supports in place, right? Then leads to this culture where we put all of this pressure on mothers and mothers are just constantly feeling like they live in a pressure cooker, right?
Mhm.
So that
Mhm.
is how I see the system really pushing mothers in this country, especially to the very edge again of what they could possibly manage. And just acknowledging that, right, either in the
Yes.
therapy room or encouraging moms to do that on their own gives them such a sense of relief. And also recognizing that as mothers, we are not alone in feeling that pressure, in feeling those expectations, in struggling with maybe returning to paid work after giving birth 2 weeks ago or something
Yeah,
absurd like that, where you're still physically and emotionally healing from a life changing experience, right? And so it's important to acknowledge all of that and recognize that that is absolutely part of the big picture and what's happening here.
absolutely. And I heard you mention you do have a few like individual coping skills. So when I think of that powerlessness feeling, right, especially like what's going on with systems that are in place or with government or things that policies, things that seem we can feel very helpless. A natural reaction is to feel powerless, and powerless can often make us feel stuck and feel like we don't have freedom to choose. And so, what are some of those like individual coping skills or choices that come up for you that can give people agency?
Yeah, absolutely. And I think agency is the key word there, right?
Mhm.
And I also like to, when I'm talking to mothers about mom rage, is I really like to play to their strengths, right? So we really want to make sure, because again, we don't want to just add random coping strategies to someone's to-do list.
Yes.
So the example that I like to give is if we were to look at the research, we would find somewhere that, meditating for 4 hours a day would probably would help with rage, right? Well, there's a few reasons for that. One, if you have 4 hours a day to meditate, that you're probably in a pretty privileged place.
Yes.
So that's already putting you at an advantage, right? Um, and so thinking about that and thinking, okay, now how can we take this evidence-based strategy that we know works and weave it into someone's life in a way that feels accessible and
Yeah.
practical, right?
Yeah.
So do we take then that 4 hours of meditation, right? Do we take this, somatic and cognitive practice, and do we then say, okay, for the 5 minute drive that you have by yourself from where you're going from your paid work to pick the kids up from daycare, do you are you able to sit quietly in your car and again hear yourself think or say some nice things to yourself or think
Yeah.
about your day or reflect or whatever the case might be, right? What would then be meditative for you, right? At a very minimum, I always like to take moms back to what I consider the beginning and have them acknowledge the reality of what is happening in their life and the reality of what they're experiencing, right? Which sounds so basic and so simple, but it's so critical, right? Because if we don't
Mhm.
acknowledge what's happening for us, then we can't move to the next steps. So an example of acknowledging would be a mom saying to who is experiencing mom rage, saying to herself, I am feeling really angry right now. I'm feeling really upset right now. Getting these kids out of the house in the morning is a nightmare, and I'm really struggling. I don't feel supported. That's acknowledgement, right? So if
Mhm.
you can't do anything else, start with some acknowledgement. That's so validating. It's so
Mhm.
validating, right? You
Mhm.
can acknowledge for yourself if you have a really great friend and a really wonderful support system. I bet if you text them or call them and tell them about the difficult morning that you had with your kids, they're not going to say to you, oh, you're a bad mom. They're going to say, yeah,
Right.
yesterday I had the same kind of
Yeah.
morning with my kids and I totally get it, right? So that acknowledgement, whether it be us doing it for ourselves or somebody else helping us with that, can be really validating.
Yes,
And
validate it, and I like it, like, without criticism, right?
yes,
Just naming it
absolutely.
for what it is without
Right, right,
criticism.
without the judgment. And then the thing that we can add to that, and you alluded to this earlier, is using curiosity and not judgment. So if you're noticing that the time that mom rage is coming up for you is bedtime, right? Instead of saying to yourself, I'm really bad at bedtime. I get angry every night at bedtime. I am just bad at this and I'm a bad mom. What you can do instead is use curiosity instead of that judgment. And you can ask yourself, what is happening at bedtime that feels so triggering for me?
Mhm.
Am
Mhm.
I really exhausted
Mhm.
myself? Do I feel, am I the, if you have a partner, am I the only one putting the kids to bed? So I feel like this is all on me. Are the kids overtired and overstimulated? And maybe we need to change their bedtime. Like, what is contributing, right? So we're asking, what is happening instead of what is wrong with me? And that what is happening then gives us critical information that we can use to then help finesse the situation to help it get to a better place, right? Maybe bedtime needs to change. Maybe you need more support at bedtime, right? There's lots of different things that we can do to move things around to not have it be so triggering and so challenging. So using curiosity and not judgment is key also.
Yeah, yeah, and I love that what is happening versus what is wrong with me, right? Because that what is wrong with me is shame and it keeps us really stuck and it keeps us feeling like we can't get out of it or hopeless that things will get better. But that what is happening keeps us curious and keeps possibility alive to make change and get out of that cycle. I really like that. So let's chat a little bit about the moms that maybe are like in the moment, feeling the rage rising in real time. What can she do in the moment?
So the first thing you have to do is recognize that it's happening, right? And so you really want to pay attention to what are your warning signals for
Yeah,
rage. Jesse, you specifically mentioned that for you, you could physically feel it, right? That's
yeah.
really common. So for many moms, it's a tightness in the chest or the shoulders or, in their neck and anywhere, right?
Hmm.
So for some moms, they kind of get short of breath, right? Like it's a very somatic physical feeling, right? For other moms, it's cognitive and it feels like there's like a freight train running through their brain and it's relentless. So pay attention to what are the warning signals for you that that rage is about to hit, right? And so once you have an understanding of what those warning signs are for you, you can then put measures in place that can help to manage those mom rage moments actually in the moment. Either we catch them right before they're happening or when they're happening. Frequently, what I find is best for clients when they're able to catch those moments is to, if it's possible, to remove themselves. And when
Hmm.
I say remove yourself, I don't mean, especially if you have younger children, right? You're not leaving your house, right?
Yeah.
But if you have a toddler, you're saying, I need to run to the bathroom right now. Or mommy needs just a minute. I will come right back and help you with your dinner, but I just need to step away right
Yeah.
now. Right. And
Hmm.
so taking those breaks, whether they be physical or cognitive, removing yourself from that situation in some way can be really helpful because what it then does is it gives you a pause. And that
Hmm.
intentional pause is so powerful because then you are stopping the rage in the moment and then you can put something in its place, right?
Hmm.
And
Hmm.
so that is what I encourage moms to do when you're in the moment and you're able to catch yourself, right? Right before you go over the edge or right at the beginning of going over the edge, remove yourself, right? And that can be really helpful and that can kind of bring that nervous system tension down, bring that temperature down, and then you can, and even it doesn't have to be, it can just be for a brief moment. It really doesn't have to be like we're just talking about a beat can be
Hmm.
enough in
Hmm.
order to give you that space, right?
Yeah. Yeah. Um, there are a few things that I do as well personally, so I want to share because I'm trying really hard not to be a yelly mom. And so, one little simple trick that I do is when I feel that urge that I want to yell, is I sing. I sing to them because it's really challenging to sing in a grumpy, rageful way. At least it is for me. But that singing also is good for my nervous system. And so, like, I'll sing to them to put their shoes on to get out the door. I'll sing whatever direction that I was going, getting the urge to want to yell, and I'll sing it to them. And so, my kids would tell you that I love singing because I sing a lot.
That's great. What a great replacement behavior, right? So I
Yeah.
have a colleague who is a somatic therapist and a certified yoga therapist. So she encourages movement during those moments of
Yeah.
rage. So, like, if you feel like slamming a door, waving your hands around instead.
Hmm.
You know, if you feel like kicking something, stomping your feet. So
Yeah.
I
Yeah.
I love that. Yeah, and again, it's really about there's so many strategies out there. It's finding what is a good fit for you and then
Yes.
building that muscle memory, getting into that practice. So whether it be, so for me, it's taking a break and removing myself. That is what
Uh-huh.
works best for me. For you, it's vocal, right? It's
Uh-huh.
moving from, I feel like I want to yell and I'm going to turn it into singing. For my
Uh-huh.
colleague who does yoga therapy, she moves her body in some way that feels healthy and safe, right?
Uh-huh.
And so there's all of these wonderful strategies. So I encourage your listeners to try them out and to figure out, what works for them. And it's okay if certain strategies don't work because there's plenty of
Right.
others that will work. It's really about playing to your own strengths, knowing yourself, and doing some trial and error. That's definitely part of this, right? Before finding, oh, this feels like the thing. Again, that
Yes.
feels super accessible to me and that I can just reach out for in the moment. And that becomes second nature. That's actually exactly what we want.
Yes, yes. And with any coping skill, I always tell my patients, I give the example of it's like a fire drill. We practice fire drills in school when there's not a real fire so that our brain and our body knows what to do in the event that there is a real fire. And coping skills, we want to practice them even during neutral moments so our brain and our body knows what to do when we really need it and need to call on it. And so getting that muscle memory, exactly as you said. I also want to just touch on the power of rupture and repair. This is something that I am coaching moms through all the time, and I'm sure you are as well. Can you explain to us, after the mom rage episode, what rupture and repair can look like and why that can be healing in a parent child relationship?
Yeah, I think that this is really a critically important concept, right? So we are human, and even when we are doing our best and, as moms, trying to put these coping strategies in place beforehand and in the moment, sometimes we will still get to a place where we have these mom rage moments and we explode. We yell when we didn't want to,
Hmm.
whatever the case might be, and we feel terrible afterwards. Instead of going into that space of, I'm a bad mom, there's nothing that can be done here, right? Because we are holding ourselves up to this standard of perfection in motherhood. What we can do instead is recognize that rupture and repair is actually a gift that we can give
Hmm.
to our children. That's how I
Hmm.
describe it to my
Yeah.
clients all of the time and to the moms that I work with. What you're modeling with rupture and repair is, instead of teaching your children that the only acceptable standard in our household is perfection, both for me and my behavior and your behavior, right? Is, we are human, we make mistakes, we do things we're not proud of, we get to places that we were trying to not get to and that we're working
Hmm.
so hard on, but we have these really difficult moments. And what we can do, instead of beating ourselves up about it, is we can say to ourselves, okay, I had this mom rage moment. I am not proud of it, but what I'm going to do is I'm going to take accountability for it and I'm going to explain it to my children, right, in a developmentally appropriate way. So whether you're talking to a toddler or you're talking to a teenager, you take accountability, you say sorry, you tell them that you're working on it, and you bring them into that process, right? So, for example, if you're talking to a teenager, you can say, hey, I'm sorry that I yelled at you for not getting your homework done, right? That was not my intention. I'm super sorry. I understand that that was upsetting to you. I am working on it. Next time when we are talking about homework, I am going to work on, thinking about how I want to talk to you about it. And these are the things that I am going to try to say to you instead. And I'm really sorry that I hurt your feelings, and I'm working to do better, right? And then
Hmm.
checking in and see how they are doing also, right? Giving them the opportunity to express their feelings again without judgment, right? Like, our children have very complex emotions also. So giving them the space to express that. And then also letting them know, like, hey, like, when you have moments where you're getting upset and you get to a place where maybe you didn't want to get to, like, we can talk about it, right?
Hmm.
And we can help each other to do better, right? That is rupture and repair. Rupture and
Yes.
repair is this idea that we take accountability and we try to do better rather than living up to an unattainable standard of perfection. And what a gift to model that for our children, because it gives them space to be human and it gives them space to do better, but to do better with compassion and
Yeah.
kindness, rather than judgment, which doesn't get us anywhere.
Yeah. And I think rupture and repair is also just modeling. I have two girls. They are 4 or just turned 5 and 7. And so not only am I modeling to them to do that, right, in their relationships, but also to expect that in their future relationships, right? That humans do sometimes have big emotions and big moments, but we also, in order to repair and to build trust and to have accountability, we look for that repair part, which is taking that accountability, apologizing, naming it, because I never want my kids to think that it is just acceptable all the time to be yelled at or treated in a way that doesn't feel good to them. And so, and that's hard if you were raised in a family that never took responsibility, or you never had a parent apologize to you, or just never talked about things. I mean, I hear so often from people who, had parents that had big meltdowns or big moments, and they're like, but then we just went on with our day, and that was dad, or that was just what we expected, and that's confusing to a child. And so I name that with my own children. I say, mom yelled, and that probably felt really scary, and you didn't deserve that. I was really overwhelmed, but I didn't use my calm down strategy at that time, and so next time I'm going to take a big deep breath and a big drink of water, and I'm going to really try hard to use my calm voice with you. I'm repairing all the time.
Yeah, and what
And it
and
doesn't allow it, right? It doesn't excuse it, but it
right,
is building that trust with them, building that connection, and modeling to them.
right.
Yeah.
Right.
Yeah.
And what a gift to your children, right? To show them essentially, I am working to break these cycles and I am bringing you into it and I am teaching you this healthy way to manage these really difficult moments and this really caring way, both for me as the person who is struggling with this moment and you as the person who was on the receiving end, right? Like,
Yes.
I'm going to care for all of us in this moment and I'm going to show us a healthier and better way to manage this. And that is truly such a gift. Something small, I'll just throw this out there, that I
Yeah.
do in moments of much rupture and repair. So I have two boys. I will ask them for consent. Essentially, I will say, do you want a hug?" Right? Because they might be upset with me and they might
Mhm.
not want a hug in that
Yeah.
moment, and they're
Yeah.
allowed to say to me, like, "No, I'm hurt right now and I don't want a hug right now." Or I'll even ask them, "Are you ready? Like, I understand that I might have hurt your feelings. Do you want to talk about this right now? Because if not, we can wait and we can talk about it later when you're ready." And sometimes they'll say, "No, I'm ready to talk." And other times they'll be like, I need I need a few minutes or I need an hour or we'll come back to, like, because they're 13 and 9, now they're at a place where they can express that to me. And I feel like,
Mhm.
especially as boys, teaching them that you don't just steamroll
Yeah.
people because you need to get something off of your chest. You ask for permission, you ask for consent, and what you're really looking for is reciprocity. And what you're really wanting is to make sure that the other person is okay. And sometimes they need a little time,
Yeah.
and that is all right. And they get to do that. And so as my children have gotten older, that has now become a really critical part of rupture and repair for us. And I can see them appreciating that, and the fact that they can say to their mom, this is not the time, I need some space.
Right.
And then what's really cool, I don't know if you see this yet with your girls, is when they do that with each other, I'm like, oh, they're paying attention. When I
Yeah.
hear them
Yeah.
asking each other, like, is it okay that we talk about this right now? Or when I hear them doing the rupture and repair, like, sorry that I hurt you, I didn't mean it, I'm gonna try not to do it again. It really is like, those are the parenting moments that I feel like, okay, this
Yes.
is what, like,
Yes.
this is really nice. This is
This
what
is
we're
meaningful.
very
Yeah.
meaningful.
Well, such
Yes.
a important, yeah, additional layer, which is, yeah, just because I don't want my kids to learn just because I apologize to you or whoever it is that like we're all good and everything's fine and that excuses the behavior. You're allowed to say like I'm still upset or I'm not ready to move on or I need some time. That's a really good additional layer, especially as your kids get older. So thank you for pointing that out. Well, I know we've could probably talk, for days. There's so much more to, so many more layers to it. But I do want to just kind of, as we are closing our conversation today, I think about how we have been talking about unmet needs. And I know so many women who are not quite comfortable with the practice of expressing their needs. And so if there is a mama listening and has been feel like can relate or feels seen in our chat today, but also recognizes like I do have some unmet needs, what is one or two gentle steps that she can take in order to get her own needs met?
I would suggest starting small and with what that mom feels comfortable with, right? Like there's no need to kind of challenge yourself immediately, right? Like if you're
Yeah.
recognizing that you have unmet needs and you're not comfortable asking to, have those needs met or whatever the case might be, something that you can start with is okay, so I'm struggling with these unmet needs, right? I'm recognizing that I'm doing too much. I'm feeling overwhelmed and overstimulated. Let me lower some of my expectations, right? So if I have certain expectations, in terms of what it looks like to get my kids out of the house in the morning or to get them to bed or around homework time, let me lower those expectations, right? Let me be a little bit more realistic with what is actually going on in my house right now, and let me then see what happens, right? Lowering those expectations can really
Yeah.
help. And something else that I really encourage is self compassion. The way
Hmm.
that we talk to ourselves is so important. So when you hear that negative self talk coming in, like, I am such a bad mom for getting angry, good moms don't feel rage, right? A good mom is happy all of the time. All of these like completely unrealistic and harmful expectations, right? What you want to do is take a compassionate approach and say things like you and I have been talking about, which I'm human. Sometimes I
Hmm.
get upset. I'm trying to do better. I'm trying
Hmm.
to break these cycles. One of the reasons I'm even aware of these cycles is because I care and I'm
Yeah.
trying to be a good parent. I feel like so much of the work that I do as a therapist is helping my clients to recognize just how hard they're trying. I tell my clients
Yeah.
all of the time, I actually stop them frequently and I say, it's time to give yourself a little credit. Give yourself some
Hmm.
credit. Look at
Hmm.
all you're doing, right? Look at all the cycles you've already broken. Look at all the hard work you're doing in therapy. Look at all the good that you do in your community.
Yeah.
Look at how, like, just what a caring and loving parent you are. Give
Hmm.
yourself some credit. And I always tell them, if you don't do it, I'm going to do it. And then I'm hoping that
Yes.
you internalize
Yes.
that.
Oh, I'm right
Hope you
there.
can take that in.
Whenever
But
I'm obviously like so compassionate with my patients because I mean I know the research and I understand the lived experience, and they will say to me like whenever I'm saying whatever the compassionate thing is about how great they're doing and how I'm recognizing all of their hard work, they I will have women say to me like, I believe you that you believe that, but I don't believe that about myself. And I just say, and that's okay. In this moment, in this time, like I'm going to hold on to that belief about you until you are ready to hold on to that belief about yourself. And that's part of the healing work that we get to do.
yes, I love that. I frequently say to clients, I hope someday that you can talk to yourself the way that I talk to
Yes.
you. And
Yes.
isn't it amazing when in session, when a client does that, when I hear
Hmm.
them talking about themselves and to themselves in the way that we talk in
Yes,
session,
I love
right,
it.
as
Sometimes so much
clinicians?
I'll hear it's a transition of what I just mentioned, and then it'll be like, I heard your little voice inside my head after that moment. And I'm like, great, we're getting there. And then we transition to I heard my own voice, right? Saying that thing, telling myself, I'm a
Yes.
good mom that had a rageful moment.
Right. Right.
Yeah.
Right. Yeah.
Yes,
So
I
good.
love
I'm
it.
so biased, but therapy's pretty amazing.
I know. I know.
It's so
Well, I
great.
do want to mention to anybody that is listening and is thinking that, maybe they want some additional support with therapy, because you are not local, but also we have listeners from all over. But I just want to give a shout out to Postpartum Support International. PSI has a great directory of therapists that are certified in perinatal mental health and can support moms through some of the issues that we've been talking today. And so that's a directory that in your city or your state, that can be a great place to look. I don't know if there are any other resources that you like to share for mom.
So, in talking about Postpartum Support International, they have really wonderful virtual and free support groups. And they
Yes.
actually have a postpartum rage support group that is based on a lot of the work that I do on mom rage. I was actually able to help them start that group and
Oh,
put it
awesome.
together. So much of what we talked about today. So, if what we talked about today really resonates with your listeners and they feel like a support group would be a really good fit for them and something that would be helpful for them, and honestly feels low risk, it's virtual, it's free.
Free.
The group runs twice a month. That group through Postpartum Support International is run by some really wonderful volunteers who are really well versed in mom rage. And it's a wonderful supportive place. And they will notice that a lot of what we talked about today is reflected in that group. They use the same framework that
Mhm.
mom rage is not a meltdown, it's a message. Let's pay attention to it. What is it telling us? And let's be really supportive and care for each other. So, that is a resource that I really highly recommend.
Wonderful. And we will share that in the show notes as well. Well, Nicole, I just really want to thank you for taking the time to share with us your expertise and your compassion that you bring to moms, and especially the topic of mom rage. Just thank you for the work that you're doing, and the way that you see moms and support them is really meaningful.
Oh, thank you so much for all of the work that you do. Thank you for being open to talking about this topic, because the more we talk about it, the less shame and guilt that we feel, and the more supported moms feel. So that is a wonderful thing. So thank you
Yes.
so much.
Absolutely. And if folks want to get connected with you, your offerings, where can they find you?
So, a great place to find me and keep in touch is on my website, NicoleMcNelis.com. You can sign up for some updates through my newsletter. I have an entire page on Mom Rage on my website where I list all of my current trainings and my writings and my research. All of my work on Mom Rage lives in that place. And if you are looking for Mom Rage on social media, I am active on Instagram, and my Instagram handle is Therapist Mom Collective. And at this point, it's essentially all rage all of the
Okay.
time. So that's a little place to get my mom rage work in small doses, and usually with a touch of humor.
Okay.
So that's a great place to keep in touch. And I truly love this conversation on mom rage, and I am open to feedback and to talking about it. And if moms want to get connected with resources, even though I'm not local, please reach out to me and I will absolutely get you connected with resources. I have wonderful colleagues all over the country that specialize in mom rage, and I'm happy to get anyone connected with those resources. So please reach out. I'm happy to do that, and I feel honored to be able to do that.
Thank you. Thank you. Well, thanks again, Nicole. And to our listeners, I hope that this conversation has resonated with you and helped you feel a little bit more seen, a little bit more understood, and certainly to know that you are not alone. Please feel free to share this episode with another mom who you think could benefit from this message, and keep taking good care of yourselves. And we'll see you next time on Omaha Mom Talks. Thanks. Bye.